Good afternoon, Pangkat Pvao. Welcome to our Virtual Gender and Development Advocacy Talk series. I am Mary Rose Lampayan from the Human Resource Development Division, your moderator for today. As a start, allow me to acknowledge the presence of the following: Pvao Administrator Yusek Ernesto G. Carolina, Pvao Deputy Administrator Raul Z. Caballes, our guest of honor and speaker, Dr. Christia S. Padolina, City Health Officer of Navotas, and Division Chiefs. As part of Pvao's Gender and Development Program, the GADVocacy Talk is held regularly to highlight the importance of women and to promote gender equality and women empowerment. That is why this afternoon, we have invited a distinguished and remarkable woman in the field of health and medicine as our guest of honor and speaker. Without further ado, let us officially begin our virtual program with the singing of the Philippine National Anthem, to be followed by the panunumpa ng katapatan sa watawat and the doxology.
Noon pa man, malaki na ang naging bahagi ng mga kababaihan sa lipunang Pilipino. Kaisa sila sa marubdob na paghahangad ng kalayaan ng ating lahi. Kabilang sila sa paglinang ng ating makulay na sining at mayamang kultura. Kasapi sila sa pagtataguyod ng mga adhikain ng kapwa mamamayan at sa pagtugon sa mga pangangailangan ng lipunan. Katuwang sila sa pagtuklas sa mga larangan ng agham at medisina. Kapanalig sila sa pagpapairal ng batas, karapatan at katarungan para sa lahat. Kabahagi sila sa paglilingkod sa bayan at sa pagpapanatili ng demokrasyang Pilipino. Sa paglipas ng panahon, hindi nagmaliw ang kanilang pag-ibig sa ating inang bayan. Mga kababayan, ito ang alay ng mga kababaihang Pilipino para sa bayan. Tumayo po tayong lahat at sabay-sabay nating awitin ang pambansang awit ng Pilipinas.
Bayang pag-ibig, dala sa silanganan, anak ng puso, sa dilim mo'y buhay. Lupang hiniram, dulatan ng pag-ibig, sa manlulupin, di ka masisigil. Sa lahat ng lubog, sa sigal at sa langit mong babang, magilang ang tula at awit sa paglayang minamahal. Ang isang ng watawat mo'y tagumpay na naghihiling, ang ituwing na araw na kailan pa may maghihiling. Lumalang araw ng walhati pagsipa, buhay ay langit sa piling mo. Ang hikaya na pagpay makahapit, ang mga tayo ng nais sa'yo.
Ako ay Pilipino, buong katapatang nanunumpa sa watawad ng Pilipinas at sa bansang kanyang sinasagisan, nang may dangal, katarungan at kalayaan na pinaikilos ng sambay ng makadiyos, makatao, mga kalikasan at makabansa.
Dear God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. Inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen.
And here to formally introduce the guest of honor and speaker this afternoon, ladies and gentlemen, the Chief of Pvao Transition Office for Integration of Pension System, Commodore Elson K. Aguilar.
Magandang hapon, Pangkat Pvao. As we continue our celebration of this year's Women's Month, we are privileged to have with us today a multi-awarded physician as our gender and advocacy speaker. Currently, the City Health Officer of Navotas Health Department and the Chief of Hospital of Navotas City Hospital. Our speaker today is a well-respected and outstanding medical doctor who also espouses women empowerment. In 2020, she was the president of the Philippine Obstetrical and Gynecological Society, or POGS, Incorporated. She also served as the Congress President of Asia, Oceania, Federation of Obstetrics and Gynecology, or AOFOG Congress 2019 in Manila, and was the country representative to AOFOG. A woman who wears many hats, she is also a faculty and active staff of the Department of Obstetrics and Gynecology in the University of the East Ramon Magsaysay Memorial Medical Center, an advisor of the Manila Declaration of AOFOG on cervical cancer elimination, an advisor of the Philippine Obstetrical and Gynecological Society Organization of Government Institutions, a faculty for advances in labor and risk management, and a member of the Ad Hoc Committee on Breast Health and Breast Cancer Awareness. In her many years of serving the public and health sector, she received many accolades and awards. In 2017, she was a POGS awardee of Ramon Lopez Award of Merit for Community Service. She was also a Philippine Medical Association awardee of Dr. Recipe Rizal Awards of Distinctions for Government Service in 2019. For her distinguished efforts and accomplishments in the medical field, especially during the COVID-19 pandemic, she received the Philippine Federation Professional Associations Distinction Award for the Medical Profession for the Government Service category in 2022. Ladies and gentlemen, without further ado, let us all welcome our guest of honor and speaker today, an inspiring doctor, an empowered Filipina, Dr. Christia S. Padolina.
I would like to say thank you to that very generous introduction provided. Let me also say mabuhay to all our division heads, staff, and a special shout out to my classmate, Dr. Pilar, Dr. Larcy, as we fondly call her. Okay, let me now share my slide. Okay, I hope that the slides are showing well. I decided that when Larcy invited me to this forum to say an immediate yes. Yes, in as much as it is always a pride and pleasure for me to be of service not only to Larcy as my classmate, to women in all aspects. So for today, I decided that the talk would be entitled Women Empowerment amidst the COVID-19 pandemic, and I would like to say thank you to the Philippine Veterans Affairs Office for inviting me. Based on the introduction that was provided, I think that was the imprimatur of how I was able to cope up with the COVID-19 pandemic. At the latter part of 2019, I was at the top of my I was so happy. I was on the top of the world, so to speak, because I was anticipating that in 2020, I will be able to roll out the perfect vision for 2020 for the POGS, the Philippine Obstetrical and Gynecological Society, which is the premier organization in charge of taking care of the women from womb to tomb in all areas of womanhood. Secondly, Larcy and I saw each other at the Institute of Solidarity in Asia. We were also reaping the success of garnering the Silver Award for Compliance Stage for the Trailblazer Award that is for the Navotas City Hospital. With all of this in mind, I was welcoming 2020. And of course, my other background, I started out as the Chief of Clinics at Hospital ng Sampaloc and also the Medical Director of Hospital ng Maynila before transferring to Navotas. Navotas, by the way, for those who are not familiar, is in the northern side of Manila, which we refer to as part of the Camanaba, Caloocan, Malabon, Navotas, and Valenzuela. And the office, the health office there is where I live. I am in Navotas. That is why I decided to go back to my hometown so that I could be of service to the city of Navotas. Having said that, this is what I was reeling from when I assumed the presidency in 2020. There were 5,500 births per day, multiplied by the number of, let's say, couples, mothers and fathers of these births, multiplied by another threefold because of the family. This was the numbers, the staggering number that we needed to assist when the COVID-19 was declared as a pandemic by the WHO and the lockdown as imposed by President Duterte. it was overwhelming on a health system that was totally unprepared of, with disrupted health systems. Hindi tayo ready for any pandemic for that matter. That is why it was so unearthing for any city health officer or president of the Premier Society for OBGYN to face, coupled by the fact also that at the start of the pandemic, and this was March of 2020, I received a call that Dr. Gatchalian, the president of PPS, declared me as a close contact because we were sitting together at the PMA. We were already preparing how the healthcare system would be able to attend to the COVID-19 pandemic. So all of this in context was taken into assessment so that we will be able to track how we will be able to address the issue. Please take note that after canceling one activity over the other in POGs, I did not have any time to sit down and strategize. We had to act fast because time is running out in terms of a consolidated effort, coordinated efforts from the academic organization and that of the LGUs. Because the one that was badly hit was NCR. Akala namin nung nag-declare ang Taal volcano ng disaster, it was really ominous and this was forthcoming. So how did we handle that one? Okay, so this was the impact of COVID-19 on the sexual and reproductive health. Definitely, we anticipated an increase in maternal morbidity and mortality. Our highlight for this one is the newspaper article wherein one pregnant woman had to go to 20 hospitals looking for a hospital that would accept her. Everyone was displaced. Punong-puno ang government hospital, incapacitated or limited ang capacity ng healthcare workers simply because this was something new. As I've said, there was further disruption of an already interrupted and disrupted healthcare system na dagdagan pa ng COVID-19. We were all ill-prepared to handle this one. So the first thing that I did was to coordinate with PhilHealth for the RT-PCR test, so libre yan for the buntis. We also organized one webinar after the other. So March 5 pa lang kami yata ang nauna sa academic organization to call for Zoom meetings. When everybody else was shying away from the hospitals, the obstetrician did not file any leave of absence. We cannot, because somebody has to handle the pregnant patient. So that is what we were able to do. Okay, so ang laman lang ng hospital, kahit ayaw pumunta ng mga pasyente, OB, we had to handle the emergency. On top of this, we also have increased rates of adolescent pregnancy. That is why it was quite important for us to handle this because nakakaawa na wala nag-handle ng ating mga pregnant patients. Wala naman pwedeng sumama sa kanila bago din ang ruling ng mga ospital. Likewise, there was also increasing in HIV and also sexually transmitted infection because they have nowhere to go. That is how important it was to establish right at the onset a healthcare system that has a service delivery network. So it was good that the LGU was already starting this at the grassroots. Otherwise, it would have been a more difficult situation for our pregnant patients. Be it known that we were the ones who pushed for the DOH to have this one hospital command because we were on the ground, zero ground, so to speak, in terms of handling all these referrals. Patients are getting to be displaced. So what were the essential women healthcare that we have provided? Okay. First and foremost, please take note that on top of attending to the pregnancy and breastfeeding, we had to assure that they deliver at the healthcare facility where the expertise are. Even right now, hesitancy is there in terms of going to the hospital, but at least if they're going to the lying in, there is a partner obstetrician there. Worst is if they deliver at home and there is no expertise, and we just cater to the complications when they arrive at the hospital. We distributed house to house non-communicable disease medications inclusive of antihypertensive, diabetes meds, hyperlipidemia, pero sinamahan po namin ng for contraception and family planning because they do not have access. So pamilya po yan na hinahatira natin. In terms of the silent pandemic, which is the gender violence, it was an extra challenge because this is usually on a platform of a face-to-face wherein the healthcare provider has that sensitivity na mararamdaman niya na victim itong babae or yung bata of violence. That is why we had to capacitate again our healthcare provider so that this will not be left out. And then, of course, for us, frontliners, we had the problem on the fear pandemic. Fear that we will catch the virus, fear that we will bring home the virus. That is why pati yoga, nilipat natin sa virtual platform in order to reach them out. I think from 8 o'clock in the morning hanggang gabi, nagwe-webinar in order to reach out for those who have healthcare provider just to assure them that we're still here. We've conducted safety huddles with them. Doon sa mga community, meron po tayong trompa para sabihin na mag-FB live streaming sila. Natuto rin po ang community because hindi natin alam kung ano yung pinagdadaanan ng ating coworker. In fact, ang natutunan natin during the pandemic, in 2 words, be kind. It is quite important that you put yourself on the other person so that you'll better understand what is happening, especially this one. Sanay po tayo na may kausap, sanay tayo nagbebeso-beso, but this time you handle everything alone. Okay. So from here, let me now jump into how the Navotas City coped up with the COVID-19. First and foremost, we had to deal with setting up the minimum safety protocol, the apat-dapat. But even before that came in, okay, we had to establish a certain system within the city. So I reached out to the mayor. I told him, hindi ho tayo aandar. Watak-watak tayo, may gagawing activity ang health, may gagawing promotion ang, let's say, ang ating public information, may gagawing activity ang barangay. We need to act fast as one, consolidate our efforts so that we will be able to handle and provide the best COVID response. So from day one, I should say, na nakita ito as a problem. On day 5 of the declaration of lockdown, we already had this mechanism wherein every department head, including the barangay and the head of the barangay health worker, meets at 5 o'clock. And we don't discuss number. Ang dinidiscuss ho namin diretso pangalan. Halimbawa, si Juan de la Cruz, natagho siya as positive. Hahanapin po yung close contact niya. Pag wala hong close contact yan, pupuntahan po sa bahay. So ganun ka-intensive yung pag-work namin. In fact, if you would look into the COVID response of the Navotas City Hospital, we were the last in the 17 LGUs in NCR to have 1 COVID positive patient. And when we have the 4 surges, it is always Navotas who is the first to become or have the lowest positivity rate. So what is being shown is the picture of our modified lockdown mega swabbing in one of the sports complex. At the height of the surges, we had about 1,000 that we are processing, minus the earlier stages of mega swabbing na dinadala ho namin busloads dyan po sa Manila para po ma-swabbing po ng Philippine Red Cross because the Navotas City Hospital and the Health Department does not have a molecular lab to handle this kind of testing. I am happy to report that within the next 2 months, we will now become self-sufficient in terms of the lockdown mega swabbing. And of course, we know very well that we need to isolate the positives. So we build the isolation facility. We converted the schools to isolation facility. At the last stage of the surge, I should say, the fourth surge, we have already 600 beds of isolation beds. And that was an opportune time for us dahil nahirapan ho kami nung first surge. Bumabiyahe ho kami as far as Nueva Ecija para lang po ma-utilize yung mga hotel ng national government para mailipat po ang aming mga positive. But all of this helped really in terms of pushing down our statistics. The other one that helped us totally is we issued quarantine bags. Digital po. Pag yan ho tinapat sa QR code ng telepono, nalalaman po kung lumabas po yung individual sa labas po ng perimeter ng kanilang bahay. Because saturated na po mga isolation facilities. So at one point or the other, we had to resort to home quarantine. Buti na lang, that was the direction towards Omicron na pumapayag na po ng home quarantine. And of course, we celebrate two things. Number one, pag may nagsusurvive ho sa amin ng COVID-19, of course, we applaud this one and we say thank you. Bakit po? The Navotas City Hospital is a primary hospital. But what is good with this setup is I hired hospitalists, specialists on their field. So kahit ho severe case, na-admit ho namin. Kasi napakahaba po ng pila sa Tala Hospital at sa Tondo Medical Center bago ho kami makapag-admit sa hospital. We were forced to be self-sufficient on our side. The second good thing that we had is in 2019 early part, na itayo na ho namin yung crematorium. So hindi ho kami nag-worry na mapapile up ang bodies. We were able to respectfully handle the deceased, be it in the community or in the hospital. And of course, the last part of our PDITR response would be the reintegration, especially because we are handling the vaccination. So vaccination, we are now on the stage that we are giving boosters, the 5 to 11 years old, and we are also in the process of providing vaccination seals so that the community is also would have the peace of mind that the institutions and the establishments that they are going to would be fully vaccinated. Our number of positives yesterday, 2. So nandun na ho kami sa talagang pinakamababa at low levels po in terms of our COVID response. But going to that stage was a difficult one. And because of this COVID experience, there is one good thing na makukuha po natin sa COVID experience. Slowly but surely, the trust for the COVID vaccines highlighted all other response to all other vaccines. Remember that we had that harrowing experience in terms of the dengue vaccine. But with the COVID vaccination, medyo natuwa ho tayo kasi maganda ho ang education, counseling, whole of the nation approach. That is why with the Manila Declaration on the call to action against cervical cancer, we're going off the ground in terms of testing and that of vaccination. Sa ating mga kababaihan po na nasa audience, gaano ho ba ang incidence ng cervical cancer? Ito ho ay kasing taas ng let's say 2 jumbo jet na nagkabanggaan. Ganun po kataas. That is why it is important for us to address this. So our global strategy, 90% po sana mabakunahan nang bago maging 15 years old ang isang batang babae. Why 90%? Because if we are able to do that in less than 15, 2 bakuna lang po ang kailangan to be fully immunized against the HPV. For the first time, there is a malignancy. There is a cancer that could be totally eliminated with the use of vaccines. And they do not come cheap. That is why it is important that this would be undertaken on a national scale. 70% of which kailangan na testing po natin ang kababaihan. Nung kapanahunan po namin ni Larcy, or mas may edad naman ho sa akin si Larcy. Okay. Ang ginagamit ho natin, pap smear at saka visual inspection with acetic acid. Hindi na po uso yan, or it could be done on a further improved mode. And this is the HPV testing using our machine equipment similar to that of an RT-PCR. Napakataas po ng sensitivity so that we will be able to catch them very early and do treatment. The 90, 70, 90, the other 90% is that we treat them early. Sa pag-aaral po sa PGH at saka sa Jose Reyes po, kung saan po nadadala ang karamihan po ng ating cervical cancer, kung ang 4 ang pinakamataas na stage, 50% of them nasa advanced stage po. Kaya ito po yung gusto nating masolusyonan. Okay? And this has to be done. Next is an advocacy on the breast cancer, and I do hope there is acceptance in terms of the GAD projects on this one. There are 15 Filipino women who die from breast cancer every day. And if we further dissect the statistics, makikita po natin that 70% of them does not have a genetic or heredofamilial tendency. Kasi minsan highlighted lang po tayo, uy, may family history ako, nanay, kapatid, may breast cancer, magpapatesting ako ng maaga. Pero nakita ko sa pag-aaral that 70% of them does not have this history. Which brings me to the next thing. Ano ba yung symptoms na nararamdaman? The most common is breast pain. On self-breast examination, may makakapapong breast mass, may discoloration, and nipple discharge. The last two that I mentioned are already for advanced stage of breast cancer. That is why it is quite important that we start screening early. We have been coordinating with the Department of Health and that of the PhilHealth and the companies who do the high yield testing. We are bargaining with them to lower down the cost of the testing and also requesting them to have PhilHealth accommodate and reimburse the amount for this testing, because it is only through mass testing that we are able to pick up the early stages of breast cancer. So kung titingnan natin, bakit ba 70% ng breast cancer wala namang heredofamilial or familial tendency? It's because of the climate change. That is why I always tell myself, every woman, every time, everywhere has to be taken care of. The air we breathe, the water that we drink, the food that we eat, the products that we use. We should always be cognizant of this one. Merong bang disruptors? May carcinogenic material ba? The makeup that you use. Let's be kind to Mother Nature. Let's also be kind to the environment. Let us protect the women and the unborn children by doing so. Do your part for this one. And self-care is very important. This is what I refer to as defined responsibility. Take care of yourself. Marami pong umaasa sa inyo. Okay, sabi nga, bakit ka bumabangon tuwing umaga? It's because of your family. And in order for you to take care of your family, you should be able to take care of yourself. Remove all vices, especially smoking, which is very notorious for carcinogen. Drinking. Make sure that you drink enough water. Move, be active, at least 20 to 40 minutes of moderate physical activity per day. Pag sinabi ho natin moderate physical activity, ibig sabihin ho noon, nakakapagsalita ka pa, pero may kasama ng hingal because of the rigorousness of the activity that you are undertaking. Use your digital phone, your gadgets to tell you to rise up, to drink water, to breathe in, breathe out, and to do 15 to 30 minutes exercises. Make sure that you get your daily dose of vitamins. For our women to protect against osteoporosis, you need 1,000 to 1,250 or 500 calcium a day. Go out in the sun para meron po kayong vitamin D. Okay? Kumain po ng isda para po sa ating vitamins na makukuha from large fishes po. Okay? You should also be able to have a preventive maintenance, quote unquote. Parang kotse. Siyempre, kailangan po may wear and tear yan. So, ngayon po, nagse-celebrate tayo ng colorectal month. 50 years and above, kailangan din po may colonoscopy. May examen sa puso, meron pong high yield na examination sa cervix, may breast examination, and if needed, please be kind to yourself and distress every now and then. Maintain friendship. Nabi na ho nating Viber group. Okay? Do not let it stress you. Huwag ho tayo makipagsabayan, but encourage and nurture friendship. And of course, please be happy. Iwasan ho yung medyo mga negative people. And sa establishment po, so opisina po ninyo, sana po meron kayong inassign na patient safety officer so that you are able to develop a culture of safety in this pandemic. Nasa pandemic pa ho tayo, and if the science is correct in what we're getting from WHO and DOH, the pandemic is still, or the COVID-19 is here to stay. So we should be able to cope up with the new normal, ensuring our safety and at the same time going on with our daily activity. Have the patient safety planner or person in your establishment prepare an infection preparedness plan. Okay? Don't put your guards down. We're still in the pandemic. In fact, with all the sorties going along, natatakot po kami, baka bigla na naman tayo mag-surge. You and I are both Wonder Woman, Darna in our own sense. We need to empower ourselves in order to do what we are supposed to do and make a difference in this world, in our families, in the establishment, in the advocacy, in our community, in our society. So what have we learned in the pandemic? And let me borrow a quote in The Lord of the Rings. Frodo said, "I wish it did not happen in my time." To which Gandalf replied, "So do I, and so do all who live to see such time. But that is not for them to decide. All we have to decide at this time is what to do with the time that has been given to us. Let's make sure that we use that time." And as parting words, this is my dad. He is also a veteran, and I did not get tired of him telling me his experience during World War II. And with this, let me salute the Pvao office for your establishment in terms of promoting kagitingan and hero. Laban kun laban. Thank you for your attention and always be an advocate for God. Maraming salamat po at mabuhay muli.
Thank you very much, Dr. Padolina, for that very stirring presentation and for sharing your continuous monitoring of efforts to beat the COVID-19 pandemic. Okay, so at this juncture, we will be awarding our guest of honor and speaker a plaque of appreciation. So allow me to read the citation. The Philippine Veterans Affairs Office presents this plaque of appreciation to Dr. Christia S. Padolina, the City Health Officer of Navotas, for generously sharing her inspiring thoughts, experiences, contributions, and outstanding achievements in support of gender and development advocacies. Given this 9th day of March 2022 at Pvao Compound, Camp General Aguinaldo, Quezon City, Philippines. Signed, Undersecretary Ernesto G. Carolina, Administrator. So once again, let us give Dr. Christia S. Padolina a big round of applause. Thank you very much, Dr. Padolina. Okay, and of course, before we leave, okay, may I request everyone to please turn your cameras on for our photo opportunity. Please open your cameras, everyone. Okay, so let's start na po. Please give all your biggest smiles. Thank you. Okay, so there you go. Thank you very much again, Dr. Padolina, for today's, of course. And of course, now, before we leave, okay, that ends our virtual GADvocacy Talk series. Thank you very much for joining us this afternoon. And of course, for a quick reminder for our guest speaker and the members of the EXICOM, you may stay in the Zoom meeting for the second part of the GADvocacy program after the singing of our Pvao hymn. So once again, I am Mary Rose Lampayan. Thank you and good afternoon, Pangkat Pvao. The second part of the program will begin in a few minutes. Good afternoon, Pangkat Pvao. For the second part of our GADvocacy Talk series, let me introduce the Chief of the Human Resource Development Division and the Vice Chairperson of the Gender and Development Committee, Ms. Marichelle E. Estacio, as she will be presenting the GAD programs and activities.
Good afternoon to everyone, especially to our very special guest for this afternoon, Dr. Padolina. We welcome you to Pvao. Before I start my presentation, allow me to introduce to you the members of the Pvao Executive Committee who are here this afternoon. Our apologies because the head of our agency, our deputy, and the head of the Pvao Transition Office are also attending equally important meetings, and as much as they would like to be here with you today, they cannot do so, but I would I would be presenting the Pvao GAD program this afternoon. So allow me to introduce the members of the Pvao Execom. Of course, no need for introduction, si Dr. Ibarra. Okay. Here with us this afternoon are is the Chief of the Finance Division, Mr. Ferdinand Palor. Sir Ferdy. We also have the Chief of the Claims Division, Ms. Raquel Cahogiran. Then we have the Chief of our Veterans Records Management Division, Colonel Nieves Gateb. We also have the Chief of our General Services and Support Management Division, Engineer Ricky Lim.
Afternoon, ma'am.
We also have the Chief of the Management Information Division, Ms. Catherine Arojo. We also have the Executive Assistant of our Administrator, Ms. Lisa T. De La Cruz. Yung iba, I think walang camera. We also have the Chief of our Public Affairs Office, si Ms. Diane Joyce Sarmiento, and the other support staff of the Philippine Veterans Affairs Office. Let me now proceed with my pleasant task this afternoon. For Pvao, we follow the Pvao GAD framework, which is our goal is to have a gender sensitive and gender inclusive organization with defined gender responsive development plans and programs for the benefit of the veteran clientele as well as our employees. Our framework is composed of the following: inform the mind, invigorate the body, inspire the soul, improve the environment, and involve the community. Our approaches for inform the mind include the capacity building and awareness raising on God. For invigorate the body, the promotion of reproductive health rights and provision of health services to employees, provision of health services and medical assistance to veterans. For inspire the soul, we have information campaign and advocacy. For improve the work environment, we have the policy review and formulation, as well as improvements on the infrastructure. For involve the community, we have participation in historical and cultural life activities and the management of our Veterans Affairs. Allow me to present some of the accomplishments of our agency on gender and development. For capacity building, we conduct gender sensitivity seminars, seminar workshops on ending VAUC, seminars on fighting sexual harassment, and just recently we conducted a webinar on RA 11313 or the Safe Spaces Act. We also established the Pvao Men's Opposed Against Violence Everywhere group. So last celebration of the 18-day campaign to end violence against women, they recorded a video featuring the Safe Spaces pledge. It was recited or it was led by the members of our MOVE. We also conduct GAD planning and budgeting and GAD program evaluation using the Gender Mainstreaming Evaluation Framework and Harmonized Gender and Development Guidelines, or HGDG. To further help disseminate and inform our clients and employees on GAD advocacy, we have invited several GADvocates throughout the years. We have had a total of 34 men and women as guests for our GAD Advocacy Talk series. So we had as our guests the following: Ms. Julia Abad, Congresswoman Bernadette Herrera. Then we also have lawmakers, then former Congresswoman Leni Robredo is now the Vice President, Senator Cynthia Villar. We also invited representatives from the party list and the representative of Bataan, Congresswoman Geraldine Roman. We also invited speakers from the Academy, Ambassador Manalo, and other distinguished educators. We also participate in the commemoration of the Women's Month. So last year po, hindi pa last 2021, we conducted virtual GAD advocacy, GAD Women's Month celebration kickoff. And also the Pvao 18-day campaign to end VAU virtual celebration. We also joined activities organized by the DND, by the Philippine Commission on Women, and other government agencies. We also maintain Pvao GAD Corners and social media account, so that our clients and our employees would be informed of the latest updates on gender and development. We also produce GAD information and communication materials, or IEC, which we give to our clients and to our employees. We also conduct GAD talks during our monthly town hall meetings. Previously, face-to-face yan, in person, but now we have shifted to virtual celebrations. But with the announcement of the level 1 category, hopefully we would be able to conduct the in-person activities already. But of course, following the safety protocols. We also conduct movie screening on God issues. Because of the pandemic, we shifted to online movinars. We also launched the Her Story. This is our attempt to feature inspiring stories of women of Pvao. Ang aming unang feature dyan is si Dr. Pilar Ibarra. So for this year, meron na naman po din kaming additional 3 women whom we will feature in our Pvao Her Story. So just to give a background, yung iba po merong different special child. Meron naman pong namatayan ng asawa. Meron naman pong nagkaroon ng malubhang karamdaman. No? So we would like to feature the stories of this strong women to serve as inspiration to our employees. Of course, we also launched the Pvao God Talent. So merong singing contest. Meron din kaming video advocacy contest. Lumabas ang mga talento ng ating mga empleyado ng Pvao. And then for the provision of support to women, surviving spouses, and pensioners, we support the women's organizations. And just recently, for our mental health program, we launched the psychological first aid station, wherein our psychological first aiders and our registered psychologists assist our employees. So kung nagkakaroon ng mga problema, kailangan ng tulong o makakausap, very willing and able yung ating mga psychological first aiders. In some cases, we refer them to other institutions or to the Veterans Memorial and Medical Center. We also produced a mental health guidance and support brochure. We give this to our clients and to our employees. So nandyan, ano ba yung kailangang malaman on general health, on mental health, spotting the symptoms, maintaining mental health and well-being, taking care of mental health, and meron din pong mga contact numbers or hotlines wherein they would be able to talk to mental health professionals. So medyo naligaw yung isang slide ko kanina. Sorry for that. So for the provision of support to women, surviving spouses, and pensioner, we have set up a legal assistance desk for women. And we also provide livelihood training to our clients and our Pvao pensioners, to our employees. So for this year, webinars lang po muna because of wala pa tayong face-to-face sessions. But we also conducted several financial literacy seminars last 2020. Initially, we planned on holding a financial literacy week, but we were able to invite several speakers. So naging Pvao Financial Literacy Month na po siya. And then for the promotion of reproductive health rights and provision of health services to employees, we provide anti-cervical cancer vaccines. We also conduct annual physical examination for our employees. During the pandemic, medyo nahinto po ito, but we allow our employees to reimburse their expenses for an annual physical examination. And fortunately, this year, we would be resuming the annual physical examination. in partnership with the Veterans Memorial and Medical Center. We also conduct outreach activities for our clients. Hopefully, we would be able to do this in the very near future. In terms of the COVID prevention program of the government, we were able to vaccinate our employees. No? Meron na pong first and second vaccination and the booster shots po. We have a very, very high rating on the vaccination of our employees and our clients. We also provide anti-flu vaccines for our veterans and employees, and also anti-pneumonia vaccines. Of course, we recognize that the importance of having a physically healthy body. So sabi nga nila, mens in corpore sano. So we also have the weekly move and groove for better health activity weekly. We have shifted to the digital conduct of this, but for this year, we are proposing that we resume the in-person activity because we would be able to maintain naman the social distancing of our employees. Malaki naman po yung aming covered course, so we would be able to follow the safety protocols. And of course, we also have the Pvao VMMC Veterans Hospitalization and Medical Care Program. Our next speaker would be discussing more of this, so I would not include additional details regarding this. Of course, we also distribute ambulatory devices. Despite the pandemic, we continue to provide wheelchairs and ambulatory devices to our clients. We also recognize the contributions of women to nation building. We have awarded several outstanding women who have contributed to the war efforts and also nation building of our country. Among the women we have awarded are Lucia Nahera Mangapit Valdez, Ms. Teresa Pugoon, and we also awarded our clients and our veterans the Congressional Gold Medal. To ensure that the story of our women heroes are disseminated to the public, we have launched the FB page on Amazing Filipina Heroes. We also include regular write-ups on women heroes in our news bulletin and collaterals. We also conducted a series of webinar series featuring women heroes. This is in partnership with the University of the Philippines and other agencies. It is said that gender equality is more than a goal in itself. It is a precondition for meeting the challenge of reducing poverty, promoting sustainable development, and building good governance. The Philippine Veterans Affairs Office would continue to promote the gender and development advocacy. This ends my presentation. Thank you very much.
Thank you very much, Ma'am Shell, for that very informative presentation. Okay, and now let us have the Acting Chief of Planning and Management Division, Mr. Ferdinand C. Palor, as he will be highlighting the Pvao overview and organizational briefing.
Okay, to our esteemed guest, Navotas City Health Officer, Dr. Christia S. Padolina, members of the Executive Committee and others present, a pleasant afternoon. It is my honor to present to you Pvao as an organization that empowers veterans and motivates future defenders. Next slide, please. Shown is the outline of my presentation. Who we are, a brief of our Kagitingan Roadmap 2028, and our accomplishments for 2021. We derive our mandate from the 1987 Philippine Constitution, whereby the state is tasked to provide immediate and adequate care and benefits to veterans and their qualified dependents, and shall inculcate in the youth patriotism and nationalism. Pvao's core activity under Program 1, next slide, is related to pension and benefits operations. As shown, the veterans and their qualified dependents are entitled to 4 types of pension benefits. These pension benefits are as follows. Next slide, please. Old age pension amounting to 5,000 pesos per month granted to a veteran who is at least 65 years old or to the surviving spouse upon the death of the veteran. We successfully implemented RA number 1164 in January 2019, which increased the monthly old age pension of senior veterans, Korean veterans, and Vietnam veterans from 5,000 pesos to 20,000 pesos. That pension amounting to 1,000 pesos per month, which are granted to dependents of veterans who died in line of duty, or a disability pensioner who died due to a service-connected disability or sickness. Disability pension granted to our veterans who were disabled or injured in line of duty, and to veterans of military campaigns with a disability discharge rating. The maximum pension is 1,700 pesos per month. Moreover, a veteran upon reaching the age of 70 years old is deemed as having total administrative disability and shall also be entitled to similar benefits as those with 100% disability rating. Next slide. For non-pension benefits, Pvao extends the following assistance. Burial assistance of 20,000 pesos to help defray the funeral expense of a deceased veteran, and educational assistance which refers to the payment of school fees for World War II, Korean and Vietnam veterans, or for the surviving spouse or one direct descendant of a veteran in whose favor he or she waives such right. This amounts to a maximum of 40,000 per year to the eligible beneficiaries for a 4 or 5 year course. Next. Pursuant to Pvao's advocacy that no veteran shall pay for his or her own medicine, Pvao administers the Veterans Hospitalization and Medical Care Program, or the VHMCP, through the Veterans Memorial Medical Center and other accredited government and private hospitals nationwide to provide adequate medical and healthcare services to the veterans and their eligible dependents. Next. Pvao's second major program is the management of Veterans Affairs that includes the following programs. The Veterans Empowerment Program, which is achieved by strengthening and by building a unified Filipino veterans community, and reforms in Veterans Corporate Governance Program by widening the participation of a majority of veterans in their corporate affairs and by optimizing veterans' assets for their welfare. Pvao coordinates with some 40 chartered and affiliated veterans organizations all over the country, and we endeavor to assist in strengthening these veterans organizations, including the veterans themselves, and enhancing their capacity to contribute to the nation building. For Program 3, the core activities include the preservation and development of national military shrines and the recognition and memorialization of veterans through activities such as the U.S. Congressional Medal Award, commemorative events, partnerships with the Academy for our books and publications on Filipino heroism, and engaging private sector organizations and foundations in recognizing our veterans' self-sacrifice and valor. Over the years, Pvao has continually studied, reformed, and improved our services in order to cater to the needs of our primary stakeholders, the veterans and their families. Our long-term vision and our current accomplishments are based on Kagitingan Roadmap 2028, the agency's strategy. With Kagitingan Roadmap 2028, we're able to journey alongside with our veterans with a shared vision, that is, to build a strong veterans community which eventually become a reliable partner in nation building. The implementation of the Kagitingan Roadmap since 2014 has indeed brought transformational changes both within the organization and as well as with our stakeholders. From a frontline office that solely provides pension and benefits, we now implement projects that ensure improved quality of life that our country's veterans and their families deserve. From being dependent client, our growing veterans community becomes an active champion in nation building. And from building infrastructure and sharing stories, we now advocate for Kagitingan builders or our reminders for our love for country to inspire Filipinos, especially the youth, to join the KR 2028 movement. Next slide. In our organization, we're able to demonstrate Kagitingan Roadmap by putting our shared values at the center. It's our patriotism or love of country, integrity or having strong ethical principles, solidarity or our shared commitment to provide the best services for our stakeholders, and professionalism in demonstrating transparency, efficiency, and growth. Next slide. To ensure that we're able to provide relevant services, Pvao has its strategy refresh sessions last March 2021, wherein empowered veterans community and motivated future defenders remain as desired outcome of our KR 2028 efforts. During the session, we reviewed and realigned our goals and targets based on Pvao's current standing. We also identified risks and opportunities that can help us prepare for uncertainties, especially during the new normal. We included in the new strategy in expanding and improving our non-pension benefits target to provide 15 operational hospitals or hospital wards, and specifically by 2028 and construction of 2 hospices by 2023 to provide special care for our veterans who are already in their twilight years. We also partnered with the Veterans Federation of the Philippines to create a policy and programs that will support Pvao goals to improve the quality of life of our veterans and their families. In line with our Kagitingan Roadmap goals, here are our accomplishments for the year 2021. For empowering veterans community, as of August 2021, Pvao was able to deliver 6.5 billion worth of pension benefits for 152,017 pensioners or warm bodies, both residing across the country and abroad. The pension fund utilized includes the increase in the old age pension benefits for senior World War II, Pvao, and Vietnam War veterans by virtue of Republic Act number 1164, which increased the pension or which increased the amount from 5,000 to 20,000 pesos. As Pvao stayed true to its core philosophy, Serbisyo sa Veterano, Serbisyo sa Bayan, Pvao ensures timely and secure delivery of pension benefits through direct remittance pension servicing system in partnership with pension servicing banks and financial institutions. Pvao also expanded its validation process to ensure the integrity of the pensioners list by including contactless validation via email, Skype, and other online messaging platforms. We also listen to our stakeholders' feedback through simplified online surveys. Nevertheless, Pvao remains in pursuit of the enactment of a law to increase the decade-long standard disability pension rates of veterans. The bill, which is already approved on the third and final reading in the House of Representatives, provides a 488% increase in the disability pension rates of veterans from the current 1,700 to 10,000 pesos for veterans with a 100% disability rating. For motivating future defenders, in the first semester of the 2021, the House Committee on Higher and Technical Education approved House Bill number 5791 or an act mandating the instruction of World War II in the Philippines in higher education, authored by Representative Roman T. Romulo. Next slide. As a result of partnering with the University of the Philippines, Diliman, Quezon City, Pvao is expected to publish its book titled Filipino Women Heroes and Medal of Valor before the year ends. The Filipino Women Heroes aims to highlight the unequaled love for country and country of the Filipinas. Meanwhile, the Medal of Valor explains the significance of the award and its recipients over the years. Next. This ends my presentation. As we carry on with our Kagitingan Roadmap 2028 journey, we aim to build a culture within the organization that promotes continuous improvements to provide the best for our veterans and their families as aimed at our Kagitingan Roadmap 2028. Thank you.
Yes, thank you very much, Sir Palor, for that very notable presentation. And now, before we end our program, any more last words po, Ma'am Shell?
The floor is now open for discussion. Baka merong question si Dr. Padolina.
Yes.
Mine is, I am overwhelmed. Thank you very much for taking care of our veterans and the future generation. I especially am happy and I have this feeling of gratification in as much as yung term palang kagitingan and of course the very comprehensive program that you presented, I think should be well appreciated. It shows the dynamism of the organization and those who crafted the GAD policies and the project. It is in keeping with our present goals and it really showcases that hindi natutulog ang organisasyon. It has remained dynamic and has ensured na merong social listening dun sa magiging beneficiaries, which is the most important part. Especially during this pandemic, kailangan natin ipadama na nandun pa rin ang Pvao for all of this. So I think I cannot add any more except to say thank you for doing these things. Thank you so much.
Thank you for the very kind words, Dr. Padolina. I am sure meron tayong opportunities to collaborate in several programs or activities of Pvao. We hope to see you again po sa Pvao. And this has truly been a very productive afternoon and our heartfelt gratitude to you. Ma'am Christia, for being
Yes, I will also reach out to Larcy. Siguro part of it is really due sa cervical cancer. Siguro it's an investment that one would make in terms of the equipment or just collaborate with another agency so that there is networking so that you are able to avail of the test. Yun lang naman ang importante. And we need to start early and our logo and battle cry there is mother and daughter team. Start as early as 9 years old para mas komportable sa financial side, mas mababa ang babayaran because you only need 2 vaccines instead of 3. So yun yung habol na age. Okay? Yes, thank you very much, classmate. Maraming salamat and I am proud that you belong to the Pvao and doing your part amongst the colleagues that you have. Maraming salamat.
Si Dr. Ibarra po is one of the prime movers of our GAD program. She is the GAD coordinator of Pvao. So talaga naman pong very busy ang ating Dr.
Sige,
Ibarra. Thank you po,
i-push nyo
class.
pa.
Ma'am, nandito na po
Hi, good afternoon.
administrator.
Ay, magandang hapon po.
Rinig ba ako?
Hello,
Okay
Ma'am
ba?
Shell.
Good afternoon, Doktora Padolina.
Ay, yes, magandang hapon po at
Yeah,
salamat po sa invitasyon. At
buti nakahabol ako. I just would like to personally thank you. Yeah, for
Yes po.
for joining us and for sharing your wisdom with our executives. Maraming salamat po, Doktora. Ano ninyo
Yes
si
po.
former senator?
Baka po yun po, DOTC Secretary.
Yeah, oo.
Padolina.
Kasi
Saka yung sa CHED ngayon, yung dati. Tita ko po.
William, no? William Padolina.
William Padolina po. Time po ni President Ramos po.
Ramos, he was our Senate coordinating officer in Mindanao when he was senator. Kaya kilala ko. Yeah, I was commander in Mindanao and he was our court officer. And the wife was president ng Central Escolar University. Di ba?
Opo, tama po.
So
Tama
sabi
po.
ko, baka kamag-anak nyo siguro. Oh, yeah. Okay,
Pinsan
so
po ng
maraming
father
salamat,
ko.
Doktora. Yeah.
Maraming salamat. The pleasure is
Okay,
mine.
thank you.
And congratulations for heading a prestigious organization po. Maraming salamat po.
Salamat po. Okay.
Baka pwede kong maka-request na isang picture sa ating pinaka-head.
Yes
okay,
po.
yeah.
Yes po. Okay, thank you very much po, Undersecretary Ernesto G. Carolina. And before we end our program, I would like to ask everyone for another photo opportunity. So please turn your cameras on. At the count of 3, 1, 2, 3. Thank you very much po. Thank you so much, everyone, once again.
Thank you.
For giving
Bye-bye.
us your time, especially to our guest of honor and speaker, Dr. Padolina. That ends our program for today. Thank you and enjoy the rest of the day. Goodbye. Bye.
Thank you po. Thank you.
Thank you, Doc.
Maraming po salamat. Thank you, Darcy. Salamat po.